registration. I'm going to send you a link to register for the second part of the vaccine.
Okay.
And we're scheduling people for January 27th. So I just need a good email address for you.
During the vaccine, it gives you the lot number, the date that we vaccinated you, and you were vaccinated at the health department. We will ask that you please bring this in for your second vaccine, and this will be a record that you had your entire series. We do recommend and suggest that you consider putting this in your iPhone or your smartphone. And then if there's anyone asking, such as airlines or anyone, have you had your vaccine, it's readily available. So if you're okay, I'll go ahead and fill this card out for you. Yes? The second piece of information that I want to share with you is the vaccine information sheet. And typically a vaccine information sheet is called a VIS, and we give that with our standard vaccines. But because this is approved for emergency use, you get a 5-page document. As this information, it gives you the side effects. So typically individuals who've never had COVID infection, with the first injection, they may get a little bit of soreness at the injection site, some redness, maybe a lump, bump, some tenderness. Individuals that have had infection seem to have a response that's a little bit different and a little sooner. With the first injection, they might actually have the fever, the muscle aches, the joint aches, kind of feeling a little bit rough, like maybe they have flu-like symptoms. And that's very quick, usually goes away within 24 hours. If you've never been exposed to the virus or had the virus, then that may happen with the second vaccine. Because you are getting Moderna, you will be asked to get the second vaccine in 28 days. Before you leave today, one of our associates will be asking you for your email address, and then Gunnar will send you a link, and he'll be able to help you with that registration process if necessary.
Okay.
The other information that's very important is the V-Safe program. And we're asking that everyone that gets vaccinated to participate. And what this is, it's like a continuation of the phase 3 trial. So for example, we've had pregnant women that, of course, was not part of any of the phases of the investigation, but now we've had healthcare providers that got vaccinated and they're finding out they're pregnant. So they're registering, and that's giving us pregnancy data. We have women that are electing to get vaccinated who are also breastfeeding, and that's giving data for lactating women and for babies. For example, with myself, I had cancer last year, so this might help us to establish the amount or the effectiveness of the vaccine with someone who has a compromised immune system. So if you would, you can either register by going to this link, or you can use a QR code with your smartphone. Take your camera, hover over it, and there will be a link that comes up. If you tap on that, it will go to the V-Safe platform, and this is where you can register. What happens is that you'll get text messages periodically throughout a couple weeks, just seeing if you're having any side effects, any adverse reactions. So we would encourage you to consider that. Now, have you ever had an allergic reaction or an anaphylactic reaction?
Not to any vaccines.
Okay.
I am allergic to latex, and I have had an anaphylaxis from that.
Okay, because you have had an anaphylactic reaction, we would like to monitor you for 30 minutes.
Okay.
Do you have an Epipen?
I do not.
Okay, we would encourage you, if you've had a history, to talk with your healthcare provider about getting an Epipen, just for your own well-being with this vaccine, but also in the future in case you inadvertently come into contact with something. We wouldn't want you to be in a remote area without an Epipen. We will vaccinate you today. We recommend that you use your dominant arm, unless that's the arm you sleep on. So you can decide what arm you would like us to use, but we're going to give you 0.5 ml vaccine, and it'll be in the arm in the deltoid region. You'll have a Band-Aid, and then we'll monitor you. Are you feeling sick today?
No.
And is there any chance that you have a fever?
I don't think so. I didn't take it today.
Okay, but you're not feeling feverish or anything?
I have a little bit of a runny nose, but that's probably allergies.
Okay, I can go ahead.
And by the way, I am so excited to do this for me, my family, and our community.
It's Jennifer. I've been sitting here for 30 minutes after I got my vaccine, and I feel
great. I have no symptoms. My arm is not sore. Didn't have any kind of flu symptoms. So I will do a new video tomorrow to let you know how I feel. And just remember, please come and get vaccinated. Thank you.